The world we have created is a product of our thinking. It cannot be changed without changing our thinking. So how do we need to change our thinking when it comes to healthcare?
Finding care at the right place, at the right time, in the right quantity, from the right people.
So it's not just from looking at it from a clinical perspective, it's looking at it from the experience of the patient and understanding how satisfied they were with that whole experience.
The real concern is that they don't have a record and they aren't following you through.
I would hope somebody would listen and just maybe give it some thought. That, you know, a treatment's a treatment, and it starts at the beginning and ends at the end.
I don't think they should put this burden on to the patient. I think the patients have enough problems going on with their health.
I think we need to keep building this concept of change, understanding the process of change, looking at where there are opportunities to make change that will really improve our system.
There's a new think tank in Ontario, and it's turned its mind and resources to bringing about changes to healthcare so that people can have a better experience with the system and better health. It's called the Change Foundation. Thanks to an endowment from the Ontario Hospital Association, the Change Foundation has, for over a decade, been awarding grants for a diverse array of healthcare projects. And now the Change Foundation has found a new function and focus. The Change Foundation's strategic direction for 2007 through 2010 focuses on an evidence-based policy to support the integration of services in Ontario.
Right now, we don't know truly what integration is. We don't know what it looks like. We have some pretty good ideas. There's great theories, there's definitions, but we need some independent organization to be able to help us understand what's going on in other jurisdictions, what's working, what's not working, and how we measure integration, how we measure the success of integration.
We are going to bring together all of our data, all of our expertise, all of our experts to help the system move forward as we start to integrate services in Ontario.
We saw the opportunity to reorient the Change Foundation in a way that would explore real questions that would influence the health system and would contribute to the policy direction of the province. So from the perspective of the board of the OHA and the board of the Change Foundation, being able to influence those changes in a way that would result in a positive outcome for patients was the goal.
There are research granting agencies, there are other kinds of think tanks, but there's not really anybody right now focusing on this new thrust, on this Ontario change, that is integration.
The Foundation's second goal is to focus on quality improvements in community care and informal caregiving.
We're going to focus on services in the community and try to improve the transition process for people coming out of hospital and going back home or into a long-term care facility. So we're going to work with community partners to try and essentially map out how it works now, find out where the problems are, and fix them.
We will be looking at the experience of the patient or the client as they move through the system. The Change Foundation has involved us really early. It's equal partners having a true and equal kind of dialogue and participation will, I'm sure, result in much better outcomes for the project and hopefully for the people that we're doing this for.
The final piece of the puzzle will be driving informed policy discussion.
We bring decision makers, knowledge brokers, patients, providers, different mixes of people together in small meetings to really tackle some of the tough issues. For example, why are physicians not included in any integration effort in Ontario? They have been in other jurisdictions. So can we crack that nut for the system here?
And by bringing these people together, we will, I think, benefit from their perspectives and allow us to create solutions and options that will benefit the people of Ontario.
One of the things the Change Foundation could do would be to look at LHINs in relation to regional health authorities in the other parts of the country and see, who's doing well in integration, who's not, what lessons can we learn, and I think the Change Foundation is ideally situated to handle that role.
And that's what they've been doing. In May, in front of a packed house, the Change Foundation hosted a presentation on the challenges of integration with healthcare guru Stephen Lewis.
What can the LHINs do in the short run and what can't they do? Well, they can't redesign the physician and primary health care systems and payment mechanisms. That's still in government's domain. Though I would hope the LHINs would analyze and advocate in this area. I hope they would turn their policy minds to the facilitators and barriers of real reform and integration and achievement, and if these are among them, I think they should speak.
And in June, we gave our AGM an opportunity to hear from one of Canada's greats who has made healthcare the subject of his finest thought.
As Ontario moves towards significant reform of integration, the Change Foundation's vision and leadership, I think, will be a key to success in ensuring the success of this plan. So congratulations to you. And in the spirit of the new strategic plan, as I see it, my remarks tonight will, I hope, contribute to the Foundation's focus on, quote, contemplating the way we change and changing the way that we think about healthcare. It's a great phrase.
The Change Foundation will collaborate with stakeholders and the public as it generates research, analysis, and informed discussion on health integration in Ontario.
It's so fantastic to see the Change Foundation now jump in there with 2 feet, trying to understand what is the evidence that will drive our system in the right direction.
Seeing the Change Foundation invest time, energy, and resources in not only their own evidence-based approach, but bringing partners around the table to talk about what are the ways that we could actually improve the system based on the best evidence that we have available is absolutely the right direction.
If you're looking for a place to have an impact on the integration agenda, to learn something but also contribute something from your experience, and to try to push all the vernacular, but to try to push the envelope a little bit further, to work with a very bright and engaging group of people. And if you yourself want to be engaged, not just a talking head, but engaged in change and in thinking change, then join us.